we are lucky enough to have a few people from our Ronald McDonald House Charities global office with us today. And Hi Kim has been a champion, a researcher, and advocate for family-centered care from the Ronald McDonald House Charities side for a long time and has such deep knowledge about what is going on in the healthcare field, our area, our Intermountain area, nationally and globally. And we just thought it would be lovely to have her just kind of close us out for the day. So thank you for being here.
Thank you. Thank you, Tony. For those of you who know Tony, I'm just trying to be as cool as Tony, quite honestly. She's amazing, as is this chapter and team. My name is Hi. You can say hi. Bye Hi is also very popular. I've been with Ronald McDonald House Charities Global Office for about 8.5 years, and it's a real privilege to be here today. We have been talking about family-centered care. We've been working hard to support it and to enable it in the places where we have a presence, but to spend time away from the office, to be in a room with so many people who are such powerful, just advocates. Someone mentioned angry earlier. I would say passionate, very passionate. It's such a privilege to be able to be here and meet other people who are part of this broader team trying to advance this work. So today I'm just going to talk a little bit about our team and some of the work that we've been doing, how we enable family-centered care, and where we're going and where we think that we could really partner together. So very quickly, for those of you who are not as familiar with Ronald McDonald House Charities, we have been around for 50 years. We turn 50 in a couple of weeks. And we really, our vision is a world where every family has what they need to ensure the best health outcomes for their children. And we do that by providing essential services to remove barriers, strengthen families, and promote healing when they need health care. This is really grounded in a belief that family-centered care leads to better health outcomes. And so we have really shaped our work around this. Around the world, we have 255 chapters that operate in 62 countries and regions. So it's a pretty big footprint. And we have over, the Ronald McDonald House program is probably the one that you are maybe most familiar with, nearly 400 of them, 271 family rooms, which is like the house inside the hospital, 41 care mobile programs bringing that healthcare to the community. And then we have hundreds of local programs to support those local needs that families have. But a big part of this is our staff around the world and this team of over 281,000 volunteers who help us make it happen. When we look at family-centered care, we look at it as a strengths-based approach to healthcare, which means that looks at the full participation of families in their children's care. And we lean on these core concepts to guide us. So really leaning on respect and dignity, getting clear, unbiased information, families being supported in participating in care planning and decision-making, and of course that collaboration piece. So that guides a lot of our work. This map shows all the places that we're at in blue, and our system has really leaned in on this. Those red dots represent places where our chapters have activated something around family-centered care. And this is beyond those programs that I had just highlighted. So we're really proud that in about a third of the countries where we have a presence, chapters have been doing some work here. And our approach to that is really in 3 ways: family-centered services, research, and as a convener, educator, and collaborator. And so I'll just talk quickly about family-centered services. Again, this is looking at things like our Ronald McDonald House program and those other programs I talked about. We do not provide family-centered care. we enable it. We believe family-centered care is something that happens in a healthcare setting, and the best thing that we can do is to support families so that they can participate as full partners in their children's care. And we do that by meeting the health-related social needs that they have when their child is accessing healthcare. So that might be accommodation, that might mean proximity to healthcare, that might mean transportation, that might mean food. We're very fortunate that we have this amazing program that can provide that kind of support. The family room program, this is a picture from our family room at Curacao Medical Center. This is, again, meeting those health-related social needs just steps away from a child's bedside. And we think that's really powerful. And that Care Mobile program, where we work with a clinical service provider to bring the care into the community and to provide primary care services like medical, dental, and health education. For research, we've been working on research for about 15 years, and our work started out as looking at what's the impact of our Ronald McDonald House program. And a big thing that came out of this was that we learned, what does it mean to actually enable family-centered care? And so from this particular work, and you can see some of the findings here, we've now expanded some of our work into a more recent study that we did last year, and we're working on our manuscript right now. But looking at what does family-centered care look like around the world? So our previous work looked at how do we enable family-centered care with family-centered services. Now we want to look at what does that culture look like at hospitals around the world in countries where we have a presence, and not necessarily at hospitals that we partner with, but where if we're there, maybe we could potentially influence. So we created this survey, pushed it out last year, and we're fortunate enough to look at 8 different dimensions of family-centered care, culture and practice, and we're looking forward to being able to share those results soon. The last way that we really enable family-centered care is as this convener, educator, and collaborator. So we've been doing these conferences led by our chapters since 2015. This is a picture of our team and nurses from Labasa Hospital in Fiji. And it includes nurses from neighboring islands where they took the opportunity to say, let's lean in, let's have some discussion around family-centered care, and then let's also invite those nurses from neighboring islands that are that frontline support and make sure that they're getting the education as well. In addition to conferences, though, like this one that you've been at today, we also have chapters that have been pushing out other educational opportunities like video tutorials, soft skills workshops, creating public awareness campaigns. Our chapter in India just did one focused on dignity and respect, looking at how could they destigmatize cancer for the families that are, the oncology families that are coming to their family room program at Wadia Hospital. Some are doing local research and other things, but I want to highlight just 3 quick examples of some of our countries that have just really leaned in on this team aspect of family-centered care. So in the Netherlands, we have a pretty large footprint in the Netherlands, and the largest children's hospital reached out to our local chapter and said, hey, we have a patient family advisory council. We would love to connect with someone at another hospital, and you have all these programs at other hospitals. Can you connect us? And so the chapter said, yeah, we could do that. Let's think about how we would do that. And so what they did was they brought together a representative, someone from a senior member of the hospitals, and the 6 of the 8 children's hospitals joined in on this. So they brought together this dyad of a senior member of the hospital, as well as a family representative, generally the chair or co-chair of that particular advisory board. And they sat them together and they had wonderful conversation to share ideas, questions, barriers. So when you think about how do we institutionalize change, A lot of that will happen through patient and family advisory councils, bringing that voice in. And they've done just a wonderful job in pulling this together across the country. Last year, all 8 of the biggest children's hospitals got together and participated. And so they're continuing to serve that spot. In Italy, they worked with a member of parliament to introduce a bill recognizing family-centered care. So defining it, as well as putting money behind it to support community-based organizations that want to support and enable families to participate in their child's care. So really powerful way of working with, again, broader team, something beyond what the chapter does, to say, how can we make family-centered care more of the standard of care in this part of the world? And in Italy, and what we see in some parts of the world, in this particular country, the children's hospitals are really knowledgeable about family-centered care. They know what they're doing. It's the other hospitals where pediatric services are being provided where it may or may not necessarily be there. And so this bill helps to level the playing field for a broader audience, while at the same time providing a way to engage more community-based organizations to participate and support. And then in Ukraine, they've been doing a lot of work in embedding family-centered care into their health system. And in this case, the chapter, in addition to hosting a series of conferences, they've convened soft skills communication trainings at 4 of the largest hospitals in that country to help doctors and nurses talk with families when they're in crisis, so that they can understand, how do I actually communicate in a way that my information is going to be received? And what do I need to know about what's happening to the family so that I can better adjust and communicate with them? They've also created a series of video tutorials for doctors, nurses, and for families that they developed in partnership with the Ministry of Health, and it's posted on the National Health Service website. And these are all about what is family-centered care and how do I involve the family in their child's health care. For families, those videos are, what is my role and right in the hospital? How do I prepare for a hospital stay? What do I need to do to support my child's well-being, and how do I get my healthcare partner to work with me on that? They've also done a 360 awareness campaign, created a website, and most recently, they created a curriculum for medical schools, a pilot curriculum on family-centered care. And they took this module and they tested it out at the second largest university, medical university in Ukraine. It was really well received. And again, this is an example of where there is a team, they're looking upstream. How do I get further up? And they realized we need to get to doctors before they're practicing. We need to get to them when they're educating. And we need to bring in people around the table who can help us with this. So families were involved in giving input, what needs to go into it. The medical school was involved in giving input on what goes into it. And so it's been really powerful, and they're looking to roll that out. So what's next? For us, we look at, again, family-centered care. It's a team sport. And you heard that this morning, you've heard it throughout the day. It requires everyone to come around the table. And so for us, we're looking at our network of who do we know, who do we connect with? Because when we see families and we support families, we see them at one point in time. And we know their needs extend well beyond before they come to us and after they leave. And we know those families that we see are not everyone who needs support. And so it's incumbent on us to take a look at our network and say, who else can we connect with, build support with, to really advance family-centered care for the people who need it most. And I would encourage you, as you think about this day, all the wonderful things you've heard today, the call out to start with that story and think about, what does that mean? For us, that is incredibly important. So I would challenge you to make Tony give you everyone's contact information that you could possibly want, reach out to them, ask those tough questions, and see what can we do together. So with that, thank you.
All right. Thank you, everybody, for coming to the Family Centered Care Conference for 2024. On behalf of Ronald McDonald House Charities, on behalf of Intermountain Health and University of Utah Health and our sponsors, Cambia, thank you all for coming. Having you here at the table and listening and participating is where it starts. So thank you. Thank you, everybody.